Eguerdi on guztioi. Good afternoon. Ongi etorri. Welcome to Euskadi. Ohore bat da niretzat, jardunaldiaren hasiera ekitaldian parte hartzea.
I'd like to welcome you to San Sebastian and to open this ICIC Congress. This is a great opportunity to share our knowledge on integrated care. It's one of the main strategic axes of our government.
You are welcome to Donostia, Basque Country. We are very pleased that the International Conference on Integrated Care takes place in the heart of Basque Country, Donostia, beautiful and full of kind people city. Integrated care is one of the main strategic issues of the Department of Health of the Basque government. This meeting will allow us to generate and share knowledge about integrated care. Tengo el gusto de inaugurar.
I have the great pleasure to open this 19th Congress on ICIC19 San Sebastian, Basque Country. For all the people who participated in the organization, this has been a great challenge for the very high level of previous congresses. This meeting, under the title of A Shared Culture for Change, Assessing and Implementing People-Centered Models, has been possible thanks to the collaboration and joint work of the Provincial Government of Gipuzkoa, the City Council of San Sebastian, and the International Foundation of Integrated Care and the Health Ministry of the Basque Government, but thanks also to the personal effort of many of you. I have to underline the great effort that the Scientific Committee has made. They have been working for more than 1 year now so that this Congress could happen. I'd like to mention the speakers, the facilitators of a very high scientific quality. They found a place in their agenda so that they could be here and share their knowledge and expertise. Other protagonists of this conference, you all participants, all professionals that have fantastic projects, things that you are already doing in your daily practice. You are going to participate in workshops, in presentations, posters, debates, discussions, plenaries. Your experience is very useful, especially if we can share it. You are the soul of this meeting. You people who came here because you want to improve in your work, because you're curious, because you want to know other ways of working, because you're ready to introduce changes in your organizations, adding value to your organizations, and what's more important, helping families, patients, and carers. Thank you to all of you, because you have course to do after this meeting. You have chores to do after this meeting, and because you will have many people to implement changes in the future. Looking in perspective, in the last few years, the most important element in the transformation that happened in our health system was the integration of care. It has gone beyond of mere management. We are in the middle of an organizational change, but what's more important here, a transformation in the way of doing things, the way of caring for people. We have less fragmented caring models. We are centered on needs. We want to give well-being to people around us. We want to obtain performance and results in health, and sharing all this with the population. Out of evidence, we know that the organizations that carry out integrated care obtain better results. They give more quality and efficiency. This is what is pushing us to facilitating coordination, communication, and teamwork in primary care, hospital care, and in social services. Today's challenge is to transfer integration in a coherent way to all domains, in financing, in the organizational structure, micro and micro, in service provision, and to all processes.
Erronka eta aukera berriak ditugu gure aurrean. Horietariko batzuk
One of our main challenges is to deal with chronicity, aging, dependence,
muchos otros retos que se nos presentan.
many other challenges that we are facing. Our Ministry of Health and the rest of institutions that are here today, provincial government, city council and others, all of us, administrations, we have major access for action, especially health and social care coordination. This is the proof. Basque institutions, we are responsible for gathering all this knowledge and expertise and transform it into policies that can give answers to what society is asking. We should do that together. We should be rowing in the same direction. This is the symbol of this trainera, the whaling boat that has welcomed us in Kursaal Palace. I am really convinced that all contributions coming out of this forum will help us to improve integrated care and our health services in the last few years in the Basque Country. Finally, I would like to end by referring to the image of this Congress, the trainera, the whaling boat. It shows us that rowing together, all the professionals in teams, we will advance and we will give a better quality of life to our population. Together, all together, rowing together in the same direction, we'll do it, we'll succeed. And without further ado, I would like to officially open this conference.
Eskerrik asko, thank you very much.